So welcome everybody to this fifth lecture or fifth lunch talk about COVID-19 and its impact on transport. Today we have a talk by Dr. Koos Fransen. He's a postdoc working at the Free University in Brussels, but also at Ghent University. I just learned this morning. He will be talking about the impact of COVID-19 on transport poverty and people who are dependent on public transport. They organized, if I understood it correctly, a survey on this topic with questions about what is your situation before and during the first lockdown in spring 2020. So within a few minutes, Koos, I will give the floor to you to give all the details about this very interesting topic. Some general announcements. We had our transport research days last week, and we added recently the recordings of the keynote lectures to our website. You can also find recordings of our previous COVID-19 lunch talks on that website. So if you are interested in the keynote lectures of our research days or on the previous lunch talks, please have a look at our website, which is being updated regularly now with all the new activities that we did this year. And then a quick reminder for our next lunch talk, because our series is not over yet. So before summer, there will be a sixth lunch talk by Marie-José Oldekalter working at Goudappel about teleworking. Many of us are still teleworking to some extent. And what will be the impact on teleworking after the pandemic, and also what will be the impact on our car use intentions. And she will provide evidence from the Netherlands. So it would be nice to have a look across the borders of Belgium and see what happens in terms of research on this topic in the Netherlands. So that's it from my side at this point. So I'm going to unshare my screen now, and Koos, the floor is yours.
Thank you. Let's see, normally now you should be able to see my screen and now in presentation mode, if all is well.
Yeah, looks great.
Perfect. Okay. First of all, thanks to all of you for joining. Instead of sitting outside having your lunch in the sun, you are now looking at a screen. So I'm very, very happy that you chose to do so. Today I will present to you our research on individuals' mobility barriers in Belgium, where we focused on the situation before and during the first lockdown, COVID-19 lockdown in Belgium, with a specific focus on public transport. And before I start, I would like to acknowledge also my colleagues who worked on this report as well, Miguel, Anke, and someone else. So Miguel from Netwerk Duurzame Mobiliteit and Anke, someone else from Mobiel 21, who helped in the analysis and the writing of the report. So today I will first briefly start with a short introduction into the concept of transport poverty. I will also try to briefly describe the COVID-19 situation for Belgium, for those who are not familiar. And then I will dive into the survey that we did, focusing on a bit of background to the survey, how we constructed different profiles, and how also differences in perceived impact, not only COVID-19 impact, but also COVID-19 impact on public transport use for these specific profiles, and then ending with some conclusions and recommendations. But first of all, the concept of transport poverty, for those who are not yet totally familiar with the concept. Most of you might already guess or might know that it is strongly related to accessibility. But at the same time, we can see that just as accessibility does, it touches upon many different domains. It touches upon, for example, social domains of travel behavior, of intentions and attitudes. As you can see on the top left, the image of a woman cycling with 3 children, which is not so strange for urban environments in Belgium or in the Netherlands, for example, which shows that attitudes have an impact on accessibility, and accessibility will have an impact on our attitudes. Our spatial planning, so for example, on the right, the well-known example of the 15-minute city. The way we plan our cities has an impact on the accessibility that people have, but at the same time, people's accessibility will have an impact on how cities are planned. So for example, thinking about transport-oriented development. Then the third part on the left bottom is what I would like to call a bit more the technical aspect, the engineering aspect. How do we design our transport systems? How do we make them accessible? This has an impact on people's accessibility, but at the same time, people's accessibility will have an impact on how they should be designed. And then the last one, health impacts and the way on how we can actually travel has an impact on this accessibility, and accessibility will have an impact on our health as well, as we will see later in this presentation. So in a nutshell, we can already see that transport poverty is a very difficult to define concept. And here I added some perspectives or angles that are often mentioned in literature. The first one focuses specifically on affordability, where it focuses on barriers to overcome the cost of making a specific journey. The second one, maybe the most well-known, is mobility poverty, so specifically focusing on limited mobility options that are available. Mainly motorized transport, such as, for example, car ownership, has been a lot of research in this domain. Accessibility poverty, often related or even indicated as being kind of similar to mobility poverty, but specifically focusing more on the difficulty of reaching key activities, where key activities could be employment, education, healthcare, service, food, but at the same time, there's also much debate on what we can define as key activities. And then the last one, but also one that's been quite surging in the past decade, the disproportionate exposure to transport externalities. So the fact that certain transport systems have different impacts on different locations and also on different groups of people. And this, actually, these kind of angles, they fit within a broader framework, well, two broader frameworks, but I'd like to start with the first one, which is the accessibility framework by Flam and Kaufman, which actually says that the way we travel and our mobility is linked to travel behavior, but this mobility and the potential to be mobile is actually influenced by different aspects. So we have this access aspect, but we also have the aspect, more personal aspects of skills and attitudes. And actually, we can see this as a kind of closed system where our skills and attitudes and our access and possibilities define the level of mobility that we have, which then defines our travel behavior. But this travel behavior then again actually defines or impacts our skills and attitudes. So for example, somebody that lives close to facilities and takes the bike or walks will have a different or will develop a different skill set and attitude set, which will then again influence the way they are mobile and the way they travel. It's not just a closed system, it's also a system that's been or that is impacted by external aspects, such as, for example, our social environment, thinking, for example, of family members or friends and how they travel and how this has an impact on our own travel behavior. Governance and political structures, for example, political decisions on, for example, vehicle access regulations in cities. Our physical environment, for example, environments that do not really allow for safe cycling, or economic structures, the way financial structures impact our travel behavior. And this model actually feeds into a more equity point of view. On the right, as you can see, the framework by Karen Lucas for transport-related social exclusion, which indicate that certain barriers within this framework actually lead to certain types of transport disadvantage or social disadvantage. And when both aspects actually occur, this is when we define a possible risk of transport poverty. And this risk of transport poverty then again exacerbates the inaccessibility and possible social exclusion. And this is basically what we also want to see with our survey. How are these aspects that actually define these barriers, how are they influenced or impacted by the COVID-19 pandemic? So, to end with transport poverty in a nutshell, we can say that it's actually about the inability to participate to our society, to activities at any given place or time, because of social and transport barriers. And we define 5 major aspects. So the lack of mobility options, for example, households without a car that have lesser mobility options. The option of or the aspect of not having access to reach a certain destination. So, for example, thinking about remote working locations, which are more difficult to access. The budget that's needed to travel that may be too high. For example, the expenses to buy train tickets for certain population groups. The travel time that is too high to reach a certain destination. So, for example, thinking about public transport for remote areas, and safety and health. So travel might be unsafe or unhealthy. So, for example, thinking about children cycling to school and next to a heavy traffic, air polluted road. It's not only difficult to define these aspects of transport poverty, it's also difficult to measure. And on the left, you can see some possible indicators that can be used related to the different angle that you're using to look at transport poverty. And on the right, you can see, for example, some indicators that were used in a UK study by Karen Lucas, which actually show the relationship between certain indicators and the actual risk of transport poverty or even social exclusion. So we have a wide range of indicators, and it's difficult to define or to combine which indicators actually lead to this very specific situation of transport poverty. And this is also what Karel Martens, and some of you might have read his book, Transport Justice. This is one of the figures out of the book. And he shows that it's actually really difficult to define specific equity standards. So when do we see an accessibility level as being too low to participate in society, and when is this not the case? And he also makes a distinction between the stage of democratic deliberation, so where we have an insufficiency range, which we all agree on is a too low level of accessibility. And we have a sufficiency range, which is sufficient enough accessibility. But then we also have this kind of domain of disagreement, which in the end, in the stage of democratic selection, ends up being some kind of very vague overlap zone, which actually combines different opinions or views on what we see as sufficient or insufficient. So this basic background on transport poverty is actually what I would like to take with us when we dive into the survey, because it kind of defines the research context in which we did our survey. But before diving into the survey, I'd like to just quickly go over the COVID-19 situation in Belgium. We'll have a very small overview because I only provided an overview until the time that we did the survey, which was actually in the summer of last year. So the first lockdown in Belgium started in March, the beginning of March, and was extended to April. As all of you probably know, this lockdown was related with specific activities closing, bars, restaurants, clubs. But even more important, also when talking about equity, we also had closure of the primary, secondary schools, and also kindergartens. Parks and forests, so outdoor spaces, remained open, well, at least most of them. Some were closed due to overcrowding, and also in the peak of the lockdown, a large part of the playgrounds was closed, and all events were cancelled. So this, of course, is a first indicator that it also led to a strong change in our travel behavior and travel patterns. At the same time, we also had the regulations that only specific types of travels, which were called necessary travels here in Belgium, were allowed. And also cross-border travel was also not possible. In the end of May, they decided on an exit strategy, and in June this extended into kind of freedom is the rule again, so the numbers went down, well, at least then. Partly the activities reopened, such as, for example, schools and playgrounds, although off and on, but at least in June they did. Maybe also very important with respect to public transport was the fact that from June 2020, mouth masks became mandatory in many places, specifically looking at public spaces with many people. So, for example, public transport. And then in the second half of July 2020, which was already after our survey, the exit strategy was cancelled, and then we had a new rise in numbers, and then the continuation of the story, which I will not do here. Now, in Belgium, there was some discussion as well on how this coronavirus, how it if and how it discriminated amongst different population groups. First, there was this kind of discussion on the fact that it would not discriminate, that it would impact everyone, young and old, and poor or rich. But this was, of course, a very health-minded and even then focus. And in certain degrees it did. So we saw our general transport and mobility drop during this period. For example, these are the congestion numbers for our main congested regions, Brussels and Antwerp, which actually dropped quite significantly during the second half of 2020. But then at the same time, we also saw a clear drop in public transport. So these are the lowest three lines that you can see, orange, gray and blue, which is NMBS. The blue one is the train, and the other one are the bus and tram company. And we can see that they dropped to almost 0% when travel was restricted in the largest sense. But then by July, where regulations were actually quite less strict, we can still see that public transport only ended up around 30 to 40% of the year before. So we can see that indeed specific transport modes did drop significantly and did not rise again afterwards. Our main conclusion here is that COVID-19 does indeed discriminate, which was also one angle of the discussions that was held in Belgium. And the study here that I like to add as well is this by Patel and colleagues, who showed that it was a UK case study, who showed that households with a lower socioeconomic status often live in worse conditions, have jobs where working from home is impossible. So, for example, thinking about laborers, have less stable employment and incomes, and have limited access to healthcare. So all of these, as you might know, all of these are linked to the COVID-19 pandemic and its possible impacts. And then when we go back to our graph that we showed in the beginning, our framework presented by Karen Lucas, we can see that if we start to look deeper into the barriers, we can see a lot of barriers that actually have been impacted by or that we could expect to be impacted by the COVID-19 pandemic. For example, the fear of crime, just the use of public space, lesser use of public space, and then, for example, differences between men and women already has an impact here. Poor public transport services, as I showed earlier, they dropped significantly. The link with employment, employment went down, so also incomes went down, which are also social barriers for transportation. Ill health had an impact. So, for example, people that were in risk often were afraid of leaving their house, actually traveled less. And also poor housing. There was a lot of discussion on the impact of not having outdoor spaces and having small housing conditions, which actually also resulted in certain barriers or disadvantages. So our main hypothesis is that indeed COVID-19 will have a strong impact on travel behavior, and especially on the equitable distribution of transport options. And this is basically our premise or our start for our survey. As I said before, the aim of the survey was to see how we can define different maybe policy recommendations that would support a more equitable appraisal of the public transport situation before and after COVID, but not only looking at transport poverty from a spatial angle, so not only looking at travel time, for example, but also combining different individual aspects, such as, for example, perceptions. Some background to the survey. So it was not really part of a specific project, this survey. Actually, the idea was to have before COVID-19, the idea was to have an international exchange or international mobility to the University of Toronto to work together with Stephen Farber. And we had a small budget by the SIP budget at the UGent, which is kind of a collaboration between different universities. So the idea was to work on other things, but then when international mobility was not possible, we decided to kind of redistribute this small budget into something else, a small research on these kind of aspects. So this was also done in Toronto as well. I don't have any, I now realize that I don't have any information in my presentation on what was done in Toronto, but they did kind of the same questionnaire on the impact of COVID-19 on public transport use, but focusing much more on public transport use, whereas we kind of made it into a more general survey on transport poverty. So the impact of COVID-19 on public transport use was part of it, but the main focus or more general focus of our survey was actually just to get more information on possible impacts on transport poverty in general. And our survey was distributed or was open between June 8 and July 6, 2020. And we questioned aspects before and during the first lockdown. And maybe also to indicate, so on the left is an adaptation by Eva, a colleague of mine from the OVG, which is the kind of travel behavior diary, which is taken by the Flemish government together with, I think, the EU Hasselt. And this data shows, it's in Dutch, apologies, but this data shows that on the left, so the lower income groups actually do indeed use public transport more. So we would expect, this is only one of the indicators, but we would expect indeed that public transport will have an impact for specific population groups. So the setup of the survey, we actually questioned 5 aspects, which are the orange blocks that you can see. The first 3 ones were used in step 1, which are the social demographics, the transport options and aspects of the built environment. And then the last 2 ones, travel behavior and public transport use, were actually used to do a regression analysis on the clusters that we constructed. But I will dive into this in more detail later. How was the survey distributed? We used an internal network. One thing that you will see throughout these names here and stakeholders here, but also throughout the distribution of the respondents, is that we had a strong focus on Flanders and Brussels. So this is something to add as well, which is like the northern part of Belgium, whereas the southern part, the Walloon region, was underrepresented in our survey, which is also related to the fact that we specifically distributed the survey more in the Brussels or the Flemish part. So internally, it was distributed with different universities. We had a very long list, thanks to our 2 partners, Netwerk Duurzame Mobiliteit and Mobiel 21. We had a very long list of societal stakeholders, very relevant stakeholders, going from mobility organizations to, for example, the VDAB, which is the employment agency, to organizations working with youth in Flanders and in Brussels, to organizations working with elderly, organizations working with specific target groups such as Netwerk tegen Armoede, which is the poverty organization working on poverty. Then we also had some governmental stakeholders, so the organization of municipalities, the VBSG, different provinces, the Lijn, which is the Flemish public transport agency, and different cabinets for different ministers in Flanders and in Brussels. We also distributed using different newspapers, and we also had a small Facebook campaign. So we used a budget of around 250 euros to also distribute the survey over Facebook, which probably is the reason why, if you look at the distribution of the respondents, we also had respondents in the Walloon region of Belgium, which is actually the southern part of Belgium. In the end, we ended up with what I think at least is a quite high number of respondents for a quite extensive survey. So we had 924 respondents that were withheld. The survey was distributed in Dutch, English, and French, which also was necessary given the bilingual aspect of the country, but that was not distributed in German, unfortunately. And very important is that we also we added a premise for people to partake in the survey, which indicated that we only tried to target people who at least stayed at home for 2 days in a week or more in a normal pre-corona, pre-COVID-19 situation. Why did we do this? Because we don't want the whole population, because we're already trying to target specific population groups. But at the same time, we also saw that the number of indicators is very high, so we can't just choose certain indicators on which we can select. So we try to distinguish by indicating or by specifically focusing on people who did not travel often, in the idea that probably they don't travel often because they are limited in their travel options. And this is also, for example, something we see in OVG, which is the travel diary I mentioned earlier. It shows that on an average day, 25% of the people for Flanders does not travel, does not do any travel. So we try to target those groups that actually don't or are less mobile or actively mobile. As I said, we worked in 3 steps. The first step was the selection of relevant variables for our cluster analysis. And so we used socio-demographics, transport options, and built environment to select 7 indicators in the end, which were used for a cluster analysis. But first, I'd like to go through the distribution of our survey, because it already shows some very interesting things before actually even starting on the analysis. So these are the socio-demographic variables, and it shows that we had a very high age of people responding to the survey, but that we also had a very strong underrepresentation of children and youngsters, although we also expect them to have a specific type or degree of transport poverty. So, for example, for children, it would be interesting to see how their travel behavior is linked to, for example, limited travel by the household or by parents. We also had a relatively high number of female respondents. We also see that in relation to the average, we see that the education level as well as the income are lower, which is often a very difficult thing to do when you do surveys, is to have the specific groups represented. We also saw that a relatively high number indicated that they had a disability, but disability here was defined quite broad, so not just a physical disability. It was also, for example, visual impairment or auditive impairment or speech impairment, so it was quite broad. But at the same time, we see that more than 30% indicate that their physical fitness is average or bad out of 4 possible categories. So that's indeed also high. We had a strong underrepresentation of people with a migration background. We only had 8% that had a different non-Belgian nationality, or at least a shared non-Belgian nationality. We also saw that our households were mostly people without children, and that it was also mostly people living alone as well. And then work activity, of course, this is quite logical due to the high age. 40% was actually a pensioner in our survey. Yeah, this last one, so the high age and the fact that the high number of people with high age also shows that we might have, so that the survey was only distributed digitally, so we might also have an underrepresentation of those who are digital illiterate, so who are not able to, for example, use a computer or smartphone in filling out these kind of surveys. For our transport options, we saw that the number of people not having access to a car or not owning a car or a bike was quite high, and 13% indicated that they cannot ride a bike. And we also saw that a relatively high number of people actually used some kind of informal car sharing, so friends or family, to use a car. And number of public transport. And here, with public transport, I would like to specifically focus on bus, tram, and metro, and not the train, because for Belgium, the train is often used by higher incomes. We can see that 80% actually does at least sometimes use a bus, tram, or a metro. And then last is the built environment characteristics. So we can see that most of the people lived in a urban agglomeration, and then even more specifically, the core of an urban agglomeration. Yeah. So in the end, we did a correlation matrix, and we ended up with 7, what we define as 7 relevant indicators to define our 5 profiles. And we called it 5 profiles of transport, the transport poor, but actually 5 profiles of the less mobile is a better indication, and I will explain to you later why. I will go very briefly through this, but just to show you how we did the cluster analysis, we chose 5 clusters because it gave us the best balance between having sufficient complexity between the clusters and differences between the clusters, as well as having sufficient explanatory power. And on the right, you can see it's just a visualization of the dimensional space. It's called actually the way in which these clusters actually share different attributes out of those 7 variables. And you can see that they actually are quite distributed well. So the more they are grouped together, the more clear our clusters are. But you can also see that the 5th cluster, which we will dive into in the next slide, which are the rural elderly, so elderly people living in more rural areas, they are actually distributed all over the different clusters a little bit, but at the same time they also have their own specific cluster as well. So that's the purple cluster. So we ended up with 5 clusters, which for the sake of explaining this, we translated to not so sexy names, but at least understandable names. The mobile elderly, the young starters, the urban public transport dependent, the suburban car dependent, and rural elderly with a quite well distribution over the different clusters. We used, for the rest of the analysis, we used the mobile elderly, so the first cluster with the largest number of respondents. We used this one as the reference category, but I will explain this in more detail later. So in the 3rd step, we actually used the second part of the survey, so aspects on travel behavior and public transport use. We used those variables to actually define differences between the clusters that we defined. And here we actually surveyed on the situation before, so what we call the normal situation, and the situation during the first COVID-19 lockdown. Again, I will first go over the general answers to the questions on these last two blocks. We asked them on perceptions, some general perceptions on transportation and mobility related to more equitable aspects. And here we see that, for example, 1 out of 4 of the respondents indicate that they do not agree that they live in a cycle-friendly neighborhood. So this for us was, for example, an indication of the possibility of, for example, having a policy recommendation for cycling. We also see that although we earlier said, digital illiteracy, it's not that high, although still 1 out of 10 says they are not skilled with a smartphone. So, for example, for some aspects of ticketing, this might still be relevant. More than 1 out of 4 indicated that if necessary, they cannot afford to buy a second-hand car. This is a question that actually kind of steers towards more financial aspects of mobility. And also very apparent is that 1 out of 5 indicated that they cannot ask their social network for help for overcoming mobility barriers. So that's also quite a lot. More than half of the respondents, which is also well, actually a nice thing to take with us, is that more than half of them indicated that they would like to travel more actively. At the same time, we can see that many still stay at home, most of the time. And also a part indicates that they do not really like to travel, and this is that's 13%. It's specifically related to people, often related to people with for example, a disability, who often see travel as a burden. Because this is something that I did not mention, but we this was a quantitative survey for the most part, but we also had a lot of options of adding information in a qualitative way, so through free text options. And this, for example, was indicated in those free text options that the aspect of not liking to travel is often related to physical disability. And then, the other ones are quite logical. So 30% indicated that they are dependent on public transport, and 16% of those people indicate that not only they are dependent, but also their household, well, not dependent, limited in mobility options. And maybe also interesting is that 1 out of 10 indicated that they had to cancel, they sometimes have to cancel appointments due to their limited mobility options. We also asked some specific questions specifically on public transport related to the COVID-19 situation. And here we see that people indicate that they indeed are quite dependent on public transport, and should public transport diminish or frequency, should the frequency go down, it would have an impact on their travel behavior. So, for example, the last one shows that almost 1 out of 5 of the respondents indicate that if public transport would not be accessible or would not be available, they would have a limited access to food or food choices. So that's indeed a clear indicator of a high public transport dependence. Okay, and then we compared the different clusters to one another through a regression analysis. Where we used the mobile elderly as a reference category. Maybe important to note that we chose this category because for us it's the kind of more average category, with also a category which has all the options available for being quite mobile, but they don't. So they have a higher age, that's true, but they have a high income and education, so they don't really have very specific financial barriers on first sight. And they also have different transport options, so they have a car or a bike available. But still they don't travel a lot, and we think this is mostly related to a lower need to travel. Or for this reference group, it was also significant that their social network was limited. So the question of I cannot ask my social network for help was significant for this group. So actually they have the options, but they just travel less. partly related to a lower need, but partly related to a limited social network. And then we compared all of the different, the other clusters to this specific reference category. And the first one is the young starters, which are respondents with a lower age on average. On average, they also have a lower income. And they have access to a bike, but not to a car. And they mostly live in urban environments. When we compare them, we can see that they indicate that they more often make use of a car sharing system. They more often use public transport, so the red shows that not often and no was negatively related, so they use public transport more often than the reference group. They are more often students or unemployed, and they indicate that indeed they sometimes encounter certain equitable aspects, such as, for example, having to cancel appointments due to limited mobility options. They also indicated that they don't really like to travel more actively, so that they already travel quite actively. Specifically focusing on COVID-19, they strongly indicated that they cannot avoid public transport for a whole year, so that was relevant for them. So here, the COVID-19 impact for us was more of an indication of, one, this public transport dependency, which is quite high for this group, but also the job options, because we see this group as a group which is limited in their options due to mostly financial situations. And this is often temporary, so they are often still students or looking for a job, and they are strongly dependent on public transport and the bicycle. So, for example, the impact of COVID-19 on the job opportunities and the job vacancies will have an impact on this specific group as well. The second group to compare are the urban public transport dependent. These are respondents with on average a lower average to lower age, but especially a lower physical fitness, a lower income and education, and no access to a car nor to a bicycle, and often living in urban environments. When we compare them to the reference category, again, we see that they more often use public transport and more often have a subscription for public transport. They are again also students and employed, but this is of course logical that this is more or that this is significant compared to the reference group, which are more elderly people. But what we also see is that here this is also the category where a laborer pops up. They also indicate that they sometimes have to cancel appointments, and they indicate that they cannot avoid public transport for a year, just as the last group, but they also indicate that not having access to public transport leads to or means less access to food. So what we see here is that this group is actually linked to what we would call more structural poverty. They are strongly public transport and also walking dependent. And they also indicated, so for these, again, those more qualitative answers, they also indicated that if indeed the lower physical fitness is an issue, that cycling is often not considered as an option. The third group to compare are the suburban car dependent. These are elderly people with an average income and age. They have access to a car, but not to a bike, and they live in mostly suburban areas. But for Brussels, this is a bit skewed. When we compare, we see that these are, we see the pensioner popping up, but we also see housemen and housewomen popping up. So people working in the household. We see that indeed they don't have access, they often have cars but no bikes, and they also indicate that their neighborhoods are not really cycle friendly, although they often live within distances which are still manageable to cycle. And then what was interesting here is that we defined this as the car-dependent group, but we see that there's also still an underlying car dependence. So, for example, this group also indicated, well, at least a significant proportion of this group indicated that not having access to public transport will mean less access to healthy food. So for them, we see that there is a group which is, of course, which will be highly car dependent, but at the same time, there is also an underlying public transport dependency. And then the last group are the rural elderly. So these are elderly people living in more rural locations. They have on average a low income and education. They do have access to both car and bike. And as I said, they lived in a rural location. So here, when we look at the differences, we see again housemen, housewomen popping up, but also the other categories with respect or in reference to the first one. We also see that they use public transport less often. And that when we look at the statements, that only the statement that they are not really skilled with the PC is significant, but not very strong significance. And then can afford a second-hand car, but I think this is related to the fact that the first group actually is the most affluent group or the most wealthy group. So here, what we see here is that they are mostly characterized by low activity density and limited public transport options, so not using public transport, but that also digital illiteracy can play a role for this group. So here, the COVID-19 impact could be more focused on, for example, the impacts of the isolation effects and also the remote location, so the accessibility for other people to access their location.
Koos, can I quickly interrupt?
Yes.
So it's 17 minutes past 1. So if you want to have some time for questions and answers, I don't know when you can go to the conclusions.
Perfect.
Okay.
I am now at the conclusions, and I will be quite
sorry
short,
for that.
No, that's okay. So that there's still some room for a question. So we concluded that there is not one specific definition for a transport poor, but that we have this kind of differences in profiles, which also ask for different approaches. We saw some expected relevant indicators, but also some new ones, such as, for example, the work situation, housemen, housewomen, or laborers. Car ownership is a very important one, which is quite obvious. The importance of public transport, which then again is exacerbated by the COVID-19 impact, and also digital skills. And we're still thinking of the aspect of cycling. We see it as a quick win, but then maybe as a segue to the recommendation in the policies. So we see cycling as a quick win, but maybe not for all groups. So our recommendations are to do a follow-up research for each of those profiles. We saw that there was a strong engagement from the respondents. So 40% indicated that they were available for a follow-up research, which is quite high. We also had a lot of people filling out those free text options. But we also need to focus on some new profiles and how to reach them. So, for example, children, but also other specific target groups. That policies should be adapted based on the situation that a person is in. So we need different policies for different profiles. So, for example, as I said, the cycling might be relevant for the group of the young starters, but then for the ones who indicate that physical fitness is a barrier for them to cycle, all of these cycling policies, which have also had an uptake during the COVID-19 pandemic, they don't really affect those that specific group of transport poor. That public transport is essential, and that we need to keep building on our public transport as the main backbone for specific population groups, and that we also need to go beyond this aspect of perception. We also need more data, but I think this is a question for all of us, from all of us here. And then the last one is that we need to approach this from a multidisciplinarity focus. So we should not just focus on spatial aspects. It's also about, for example, individual aspects, which might differ strongly between different groups. So as we saw, some urban group is not the same as another urban group. And that mobility planning is not the only solution to this question. It's also an aspect of, for example, a good spatial planning. So, for example, the planning of social housing and location of social housing, for example, is a good example of how another perspective is also needed. So yeah, that's basically my short conclusion. And if there are any questions, the chat does not work. So yeah, you can just raise your hand and I'll maybe end my presentation mode.
Well, thank you, Koos. I don't know if there seems to be an echo. There's already one hand being raised by Floridea. So Floridea, if you can unmute yourself and ask a question.
Sorry, I had to close the window because was some siren. Yeah, I like very much your presentation, Koos. I think that you were one of the participants of the equity transport summer school somewhere. I don't remember if in Barcelona or in Thessalonica. And I like very much in what you are working now. Just a question about the conclusion you present us, that you say, okay, we cannot have the unique approach to transport poverty. If you can detail a little bit more about that, because in my mind, it's true that we work on transport poverty as well with the Karen Lucas, and we say, okay, transport poverty is not the same than social poverty, and we need to differentiate. Most of the time, they can be the same. They can affect the same people, but sometimes it's not the case. And we can show that in some way. But yeah, I think that transport poverty is quite clear what is. It's not the accessibility to activity. It's not to move with your children. It's not to have access to the food. And during the pandemic time was really a catastrophe everywhere in Europe, and even in our Western city in Madrid. People need to really poor people need to go everywhere, but they cannot use the public transport because the health ministry was saying don't use the public transport. So was a lot of irresponsibility done during these days by the government, from my point of view. So it's very interesting what you present, and but I would like to know a little bit more about these aspects that you said, and yes, what do you have in mind for the new transport poverty definition?
Yeah, I think in defining transport poverty, it's difficult, but I think we're getting there, and I think a lot has been done in the UK and in the Netherlands as well. But as I said, to measure, it's quite difficult because we have all of these indicators that we know have an impact in some way or another. So what we see as a definition of transport poverty, and what is actually the main conclusion of the report that we wanted to present, is the fact that we don't see it as you have a group which are transport poor and you have a group who are not. But it's actually a kind of gradation, whereas the combination of certain indicators leads to a higher risk of transport poverty or a higher occurrence of transport poverty, whereas some indicators or one indicator might be enough to have some kind of risk of transport poverty, but it might be kind of balanced out by other indicators on which people do score or have their checkbox ticked. So I think I agree with you that there are certain policies who help everyone. So for example, public transport is key and is crucial. So we need to keep focusing on public transport as the backbone, for example, for answering aspects of transport poverty. But at the same time, we also see differences in, for example, people who are digital illiterate might have different experiences with using this public transport, which is evolving and becoming more and more digital. So this is different for other population groups. And for example, I think a month or so ago, I spoke with people from an organization who work with people who don't really have, I don't know the English terminology, but they don't have an official, it's not like homeless, but they don't have an official registered address in Belgium. And they have totally different transport barriers than the ones I actually, although I'm working on this for quite some time, because indeed I followed the workshops in Greenwich and in Barcelona, but they have totally different transportation barriers than the ones I already knew. So, for example, they had access to bikes that they could use, but then they could use the bike, but they didn't have a lock to close the bike, and they didn't have the money to buy that lock. So this is also something that's it's a very specific example, but there are still enough differences between people to try to actually illustrate what these differences are. But I agree that some policies are, well, we should keep focusing on them because they help, well, the majority of the people that we try to have in these kind of surveys.
Yeah, just a very short aspect. It's we are working in a project, European project on digital inclusive solution, and what we found is not so different. I mean, it's digitalization will not provide, will not solve the problem, not during this time. Especially because we have a very still low digitalized people. So it's something like that. I think the transport policy is clear what is when you cannot satisfy the needs, the basic needs that you need in your life. But it's of course we can extend the way and the form is show us up. Okay, thank you.
Great. I think that's a great discussion about transport poverty research in general. But I see somebody else is also raising her hand, Lane, and I know she's also working on transport poverty and digitalization. So I'm wondering what her question will be. So Lane, go ahead.
Hi, Koos. Thanks for your interesting and clear presentation. My question relates to the current policy situation actually in Belgium. So we have this transition in public transport from basic accessibility, if you can translate more or less like this, to basic mobility. Can you or will you relate your research, your results to that policy transition?
Well, hopefully it will be used in a backbone, but we can have a very broad discussion. I should have left a bit more time for this kind of discussion, but the idea is actually that when we did the survey, so from the analysis, which was in the end of last year to now, we've already had talks with a lot of people. So for example, MOE, it's not because of our survey, but also because of external factors. They are specifically looking at how they can put transport poverty as a concept into policy documents, which was not the case for Flanders until now. So this, for example, is a step in the right direction. And I hope this is also, we have these talks with MOE, and then we also provide our information that we had from the survey. So we hope that this is also taken into account when they continue on this. And then maybe a second answer to your question, we're now looking into the idea of translating this into a project proposal. So that would also be the case. How do you operationalize this kind of research, and how do you combine it into both what maybe governmental stakeholders want with it, but also what societal stakeholders or organizations would like to do with it. So that's basically also the idea. But yeah, indeed, in the report there is a small notice on the transition to basic accessibility, but it's very difficult because on one hand, I do believe in the idea, and if it's executed right, but at the same time you see a lot of like red flags going up and things that are not really going well in this transition that we do need to address, and we do need to point out and underline critically, I think.
Okay, thanks.
It's 1:30, but maybe we can squeeze in one more question. So if there are any other questions in the virtual meeting room, please raise your hand. Floridea, your hand is still okay. Laurent, maybe we first go to Laurent.
Yeah, okay. Thank you for this very interesting presentation about a topic about which I really know very little. I was just asking myself one question. You emphasize very much the role of public transport. What I was wondering is, given the different profiles of transport poverty that you have identified, is public transport in itself really not a bit of a one-size-fits-all solution? While actually I would expect from what you said that a differentiated approach is needed. For instance, if someone is limited in his movements because of physical disabilities, then the discussion should really be about, should we make public transport fully accessible, or should we create subsidized services that cater to individual people with disabilities? So and same thing also about people in rural areas. Is the issue with transport poverty there to increase the supply of standard line buses, or should we again think more about dedicated services?
Yeah, that's a very good question. I think that's also the question related to what Leen said, this transition to the concept of basic accessibility. And I don't know how well you are acquainted with like the vervoer op maat options. So this is a very good question. And I think you're right in indicating that it's not a one size fits all. But I do think that public transport as in general a means does indeed, if you look at the different profiles and the fact that for most of them public transport dependence is quite high, it is indeed important, but it will not fit all. So there are people who indicated, yeah, I have, for example, a specific car which I have to drive. I can't do car sharing, I can't do public transport. I have to drive the specific car. So you need, yeah, for those people you need specific solutions which actually attain to their needs. And I think here what is very important is the very good role, I think, in Belgium that these kind of middenveld organizations, societal organizations play, because they are actually the translation from those people to policy, so that it's not just one person asking, okay, I have this specific situation, but that it's the organization that indicates, okay, we have this group of people who indicate that this is also important. So yeah, I think it's a good question, but I would just have to say that I agree with the fact that it's definitely not a one size fits all. But I stand with my point that it is, for me, it's still one of the key focus that we should take. But yeah, as I said, for example, cycling might be a good option for other people as well, and might be even more, I don't know, a more financially obtainable solution for people than providing an extension of a bus line, for example. But yeah, that's a difficult question that should be attached to each situation specifically.
Thank you.
Okay, I think we need to wrap it up now. It's already past 1:30, and yeah, probably many of you need to go to other online meetings. So yeah, just a quick reminder that within 2 weeks we have another BIVEC lunch talk about teleworking and car use intentions. So then we see another part of our transport system. So thank you all for participating. Thank you, Koos, for this interesting talk. Thank you, participants, for your questions, and hopefully see you again within 2 weeks. Take care. Stay safe.
Thank you.
Bye-bye.
Thank you all.
See you.
Bye.
Bye.